Start, Congresswoman.
Okay. All righty. Good morning, and thank you all for joining us here this morning. I'm so excited for our conversation today. For those of you who don't know, my name is Congresswoman Robin Kelly, and I represent proudly the 2nd District of Illinois in Congress. And I also serve the Congressional Black Caucus as the CBC Health Brain Trust Chair, and I'm one of the co-chairs of the Congressional Caucus and founders on Black Women and Girls. And I'm so excited to be here with phenomenal women during Black History Month. I cannot think of a better group of women to join me here today to celebrate Black History Month and discuss the effects of health inequities on our communities and how we move forward from COVID-19. It's so important for us to have this discussion this morning because it's not every day that we as Black women get the opportunity to bask in our own Black girl magic. And I'm here to say it's more than magic. Black girl talent, Black girl determination, Black girl intelligence. Especially after a year we were credited with saving our democracy with our power as a voting bloc. We accomplished this with great courage and determination and in the middle of a pandemic. I'd like to introduce you to Miss Angela Williams, CEO of Easter Seals, an organization that is headquartered in my home district of Chicago and serves the needs of many disabled individuals across the country. Welcome, Miss Williams. Miss Stacy Stewart, CEO of the March of Dimes, whose work with the crucial newborn and pregnant population is respected nationwide. Her role is so important and has helped me in my work in Congress for fighting maternal health. And I'll just throw in Miss Tracy Brown, my soror and CEO of American Diabetes Association. Welcome to you. And I know we will be joined by Ms. Linda Blangoler, CEO of the Black Women's Health Imperative, the go-to organization on all issues related to the health and well-being of Black women. And we've worked with Linda so many times over the years that I've been in Congress. I want to thank you ladies for being here. I'd like to turn to you for a few words of introduction. And let's start with you, Angela, then Stacy, then Linda, and then Tracy. You can close it out.
Thank you.
Angela?
Thank you so much, Congresswoman Kelly. And I just want to thank you and your staff for being so gracious to host us today. This is such an important and critical time in our nation's history. And it's an honor and a privilege to be here during Black History Month 2021 to really lift up our voices and talk about critical issues that are affecting our community. As the national CEO and president of Easter Seals, which is a disability organization, I'm just really privileged to be an advocate for those that are living with disabilities. There are 61 million Americans in this country, 1 in 4 individuals that are living with disability. And of that 1 in 4, 1 in 4 are African American. When we think about disability, we tend to think about physical disabilities or disabilities that we can actually see. But disabilities are both visible and invisible. They range anywhere from what you were born with at birth, whether it's a physical or intellectual or developmental disability. It could be as a result of an injury or an accident, or it could be simply a part of the aging process. Easter Seals is serving as the 102nd year anniversary. We serve individuals throughout the lifespan, from early childhood intervention to seniors and all in between. What's so unique about our organization is that we sit at the intersection of healthcare, education, and workforce development. All three are vitally important for the African American community. And what we saw with the advent of COVID-19 was all three of those being disrupted in a very real way. That's extremely, that has been, I think, a setback for African Americans. And so I look forward to this conversation and having the ability to talk about it. We also at Easter Seals serve veterans and their families. And the last thing I would say, and this has been part of the disruption, is that people of color serve as direct service providers or caregivers for people with disabilities. They have suffered enormously, whether it's with the loss of jobs, lack of PPE, et cetera. So I look forward to our conversation today to really dig into some of these issues even more.
Thank you so much, Angela. Stacy? Would you like to say a few words about
Thank
yourself
you
and your
so much.
organization?
Absolutely. Just taking myself off mute. It's so great to be with you. Thank you for hosting, Representative Kelly. And it's really nice to be joined by such dynamic women and who are doing great things in health and public health and for our country. So it's great to be here with all of you all. My name is Stacey Stewart. I'm President and CEO of March of Dimes, and we are the leading organization really fighting for the health of all moms and babies. A lot of people know March of Dimes because of a former public health crisis that we faced in the earlier part of the last century, polio. And March of Dimes sits at the very crux of being in the business of solving that major public health crisis that we had then, funding the vaccine that really effectively brought polio to an end. And here we are today in the midst of another pandemic. And here the March of Dimes is really working on a leading public health crisis today, and that is the state of health for our moms and babies. Today in this country, it's sad to think about the fact that every single day, 2 women will die as a result of pregnancy and childbirth, and every single hour, a baby will die. And that is really a striking, those are striking statistics to think about, especially in a country that spends as much as we do on healthcare, and to be the one of the wealthiest countries in the world. We are considered today to be one of the most dangerous to nations in the world in which to give birth. A Black woman today is 3 to 4 times more likely to die as a result of pregnancy and childbirth. We have a crisis for all women, but it's especially true that we have one for women of color, especially Black women, and a crisis for our babies as well, where our Black babies are still twice as likely to die before their first birthday. So we're really facing a tremendous crisis, and a lot of people are really not as aware of the fact that, and don't assume that we would have these kinds of outcomes in the United States of America, but we do. And part of our work at the March Times is to raise awareness of these issues. We've been really honored to work with Representative Kelly, who has been a tremendous leader in Congress, raising the awareness and really galvanizing her congressional colleagues to become involved in these issues for maternal and infant health, but health overall. And so we are greatly appreciative of her efforts. One of the things that we know, and I think all of us can touch on this, all of the speakers today, is that a lot of us think about health in the form of health care, health coverage, and things like that. But it's really important to understand, even as it relates to maternal and infant health, that the biggest component of what determines our health isn't what happens in the doctor's office or in the clinician's office. It's actually in how we live, the safety and health of our communities, whether or not we have access to good nutrition, whether or not we have access to safe, decent, affordable housing, all of these things that we call the social determinants of health. And so I'm really looking forward to this conversation where we can really address how we improve health overall for everyone in this country, especially for people of color, by looking at those other components of what can determine our health overall, and ensure that we address all of those issues and understand what are the underlying causes for these social determinants being such major factors in determining our health, especially as it relates to those communities that are disproportionately impacted by many of the outcomes that we're facing today. So thanks for allowing me to be a part of this conversation, and looking forward to questions and answers and a great dialogue. So thank you.
Thank you so much, Stacey. And we're so committed, in particular, to the maternal mortality issue, devastation, I would say, in the United States. With that, welcome, Linda. I already talked about you a little bit, but we would like you to take about 3 minutes for an opening statement and introduce yourself.
Well, thank you, Congresswoman Kelly, and to my esteemed colleagues, and for your patience with some technical difficulty. I'm Linda Golder-Blount, President and CEO of the Black Women's Health Imperative. And this is year 39 for us, being the only national organization focused on the health and wellness of Black women, physically, emotionally, and financially. And so, honestly, as my sister colleagues have said, this couldn't occur at a more important time in our history. The Black Women's Health Imperative was founded as a self-care organization. And Billie Avery brought 2,000 of her closest friends together onto Spelman's campus to talk about how we should take care of each other, but more importantly, how we should take care of ourselves and practice self-care. And that has informed all of our work for all of these 39 years. And now as we kind of look at what's happening, this notion of intersectionality is really highlighted. Black women, we've seen now, live at the intersection of racism, of economic oppression, of health disparities, and it's playing out in our health as we see. 2020 will go down as a year of heightened PTSD. We've already seen plenty of examples of how Black women are suffering from stress, from seeing graphic police and violence, from losing close relatives, loved ones to COVID-19, to facing an angry, unmasked public for those of us who don't have the privilege of working from home. Our research has shown that actually mental health and stress is the #1 health issue for Black women. And when we look at something like COVID-19, where we're not only contracting it, but dying it at 2 to 5 times the rate of white people, depending on what city you live in, it becomes really apparent how serious this is. A year ago, people weren't paying a lot of attention to Black women, as you know. Suddenly we became essential. Suddenly we're on the forefront because we're the ones taking public transportation to work. We're the one working the jobs of frontline workers. We're the ones who don't have that benefit of being able to force people to wear masks around us. And so that has increased our exposure. But all of this that we're seeing, is not new. It was predictable back in March when all of this really started. And all of this stems from, frankly, 400 years of historical legalized oppression. And so that's why the work of Easter Seals and the American Diabetes Association and March of Dimes is so critically important right now, because all of this work not only speaks to the health of the woman, the mom, the caregiver, but literally the community. What we're doing keeps our communities vibrant and resilient. And that's why the Black Women's Health Imperative has programs to prevent chronic disease and HIV, maternal mortality, and to ensure reproductive justice. And that's why we provide evidence and research and information so Black women can make the best healthcare decisions for themselves and their families. And that's why we work with Congresswoman Kelly and the Congressional Black Caucus, so that we can make sure that policies are developed, enacted that place Black women at the center, that promote health, that eliminate barriers to doing what we want to do anyway, which is to be as healthy as possible. And that's why this conversation is so important. Because last year, I heard, probably like many of you, from so many folks, I had no idea. I had no idea health disparities was a thing. I had no idea racism was a thing. I had no idea that racism and health disparities were related. We've been talking about this for a very long time. So I'm really excited about this opportunity to have a conversation so that we can look at the issues, so that we can start developing the policy solutions and the program and practice solutions that we've all been working on for years, and so that no one can say anymore, I had no idea. Thank you.
Thank you. Thank you so much, Linda. Wow, 39 years. And I said before you got on how we work with your office so much, and you've been such a resource to us. So thank you so much. And last but certainly not least, Tracy Brown, if you want to give us a few words before we get into the conversation and the questions.
Absolutely. Congresswoman Kelly, it's always a blessing to be with you. And thank you for hosting and bringing us all together. And to the other phenomenal leaders on this Zoom call, it's a pleasure to be working together to drive some change. And certainly, as we think about Black History Month, I would be remiss not to talk about Dr. Carter G. Woodson, who is the founder of Black History Month. And really, over a century ago, he wanted Black History Month to be a vehicle to drive transformation and social change. And that, again, couldn't be more relevant today than it was 100 years ago. As the CEO of the American Diabetes Association, one of the things that I talk about is that you can't talk about improving the health and well-being of people in this country people of color in this country without talking about diabetes. And you certainly can't talk about increasing the health and well-being of people of color in this country without talking about health inequities. When you think about the fact that 1 out of 2 people in this country are living with diabetes or pre-diabetes, and every 2 minutes somebody's dying or having a stroke from diabetes and its complications. Every 4 minutes somebody's losing a limb, and every 10 minutes somebody's having kidney failure. And if you're a person of color, those numbers get astronomically worse. And so we have to ask ourselves, are people of color genetically sicker? The answer is no, right? We've heard that already. This is about the inequities. And as Linda has talked about, the 400 years of policy, procedures, legislation, mental models, all of that. And so the only way we are actually going to allow great health and great access to health care, because that's a human right. Everyone deserves that right, regardless of the color of your skin. The only way we're going to do that, Congresswoman Kelly, is we have to continue to work together to drive what we talk about is groundwater solutions. What we're talking about, this inequity is in the groundwater. And so that's part of the reason the American Diabetes Association is leaning in hard on our Health Equity Now platform. And we can't do it alone. It's going to take all of us to get that done. And so I'm excited to get straight into it, Congresswoman.
Thank you so much, Tracy. And, you know, those statistics, as we say, they might be shocking, but as was mentioned, but they're not surprising because this has been going on forever. I know your organization sent an open letter to President Biden and VP Harris asking that the administration continue working to end COVID-19 and prioritizing and addressing and ending health disparities by responding to the healthcare needs of Black Americans and ensuring quality and affordable health. What quantifiable changes would you like to see come from the administration, and how can they engage with organizations like yours to ensure these changes are enacted? You can jump in.
Well, I'll start by just saying that from the lens of disability, but I think it applies to everyone. And we've heard it already about access to quality health care and ensuring that the ACA is strengthened. That's extremely important. Then we heard Stacey talk about the social determinants of health. We know, for example, Black folks tend to live in food deserts. There's the issue of transportation. There is the issue around quality education. One of the most important things, for example, is Medicaid. Medicaid exists to serve those in critical need of supports, long-term supports and services, whether it's people with disabilities, seniors, and others. What I'm concerned about is that as Congress continues to look at budget cuts, and especially with the huge outpouring of money over the last year or so, there's going to be this push to look for budget cuts and budget reconciliation and all of those things that you know so well. The concern that I have is that this will be done at the expense of Medicaid. I've already talked about the fact that direct care support providers and caregivers, they are currently grossly underpaid and reimbursed. The reimbursement rate from Medicaid is extremely low. We continue to see turnover rates of anywhere from 40 to 50% of caregivers. To me, that's a national crisis. And to me, that begs for a solution. And I'll stop, but I will just say that when it comes to education, funding education programs, and then we talked about even social justice, criminal justice reform, we see that if kids, and especially Black kids, and especially Black boys, are labeled and they're not identified with having an intellectual or developmental disability, and the intervention process is not started, then what we see is a public school to prison pipeline. So again, there are just so many intertwined issues that have to be addressed, and Congress needs to take a look at these seriously.
And I would say, I would add to that we have to start with the assumption that racial and ethnic disparities and inequities will occur. I mean, we always see that. I mean, there's this old saying in medicine, effective technologies are always disparities producing, because those who have resources get the effective technologies first. And so as you do, Congresswoman Kelly, you start with what will the impact be on the lived experiences of a population? And if legislators start with that and start with the assumption that disparities will occur, then that can reframe the way they approach the work. So in science, for example, I want to see diversity requirements enforced for clinical trials. I want to see more high-level grants go to researchers of color, because what becomes evidence depends on who's asking the questions and who they're asking. And I want to see reimbursement. I mean, Angela's talking about Medicaid. I am absolutely in agreement, but I want to see reimbursement for hospitals and providers connected to quality outcomes by race and ethnicity, because I guarantee you, if hospitals were reimbursed on the basis of their Black maternal health outcomes, we would see the Black maternal death rate drop. And, talking about public education, we need to see a public education system where child achievement isn't tied to poverty, because that guarantees low achievement. If we're only funding our schools on the basis of income taxes, property income taxes, then we're already building in inequities. We've learned so much in the last year, and it's rare when we get a chance to predict the future, but this is one of those opportunities. And so now we have an opportunity not to repeat the past mistakes and to actually create a new future for ourselves and our community.
Yeah, and I'll jump in there too, Congresswoman Kelly. We have to continue to lean on these legislation and policy changes. So again, if you just take a look at some of the recent data, 50% of low-income Americans with diabetes have lost some of their income right now. 1 in 5 people are choosing between whether to buy food, pay the rent, or get the diabetes medications that they need. 43% of people have delayed their care, diabetes care, and that's deadly. As someone who's living with diabetes, you just can't do that. And 1 out of 4 people are rationing either their insulin or their oral medication, or testing their blood sugars. These things are deadly. And so when you start to think about what we're trying to do and needing to do collectively with Congress, we've got to drive access first and foremost. Everybody needs to have access. And, I've heard, with COVID, telehealth, and all of those things, these are all good things, but they also have to be reimbursable. And so we are continuing to work with Congress on those things. You actually have to have the ability to have affordable care. Again, and so we are asking for, when you think about the number of people who have lost their jobs right now, this notion of continuity of healthcare coverage becomes a very, very critical component and piece of the equation, because we know insurance correlates to your ability to live a healthy, thriving life. And then when you talk about nutrition and diabetes inexplicably linked, we've got to do more. The number of food deserts and food swamps that are in this country, and particularly in the zip codes for people of color, it's unfathomable. And so we've got to do more actually to disrupt that. And then finally, when you just talk about the COVID testing and the vaccines getting into the neighborhoods that actually need it, these are the pieces of legislation that we are leaning in with on Congress to kind of drive. We've got to get the funding. We've got to get the access into the neighborhoods that need it most.
And Representative Kelly, if I could just add to that, and all the points are extremely well taken. I just want to take a step back, because I think, and Tracy, you may have mentioned, I think you did mention it earlier, when we talk about inequities, there's often this sense of that we have so many inequities or disparities in communities of color because of something genetically wrong with communities of color, and that's just simply not true. If we ask the question, when in this country, in the history of this country, have we ever provided equal access to affordable, high-quality healthcare for everyone, especially and including Indigenous people, descendants of the formerly enslaved people? You can honestly say that has actually never happened. We have never happened. People of color have never had access to high-quality, affordable care in this country ever. And on top of it, living with the kinds of experiences stemming from racism, discrimination, a whole host of other things that have impacted our social systems, that have created this environment in which we live in situations that don't produce, the best health outcomes. We've been living for hundreds of years in a situation that this country has never had the will to address. Only by investing and through policy change are we going to be able to really address the health inequities that we see. And that is true for maternal and infant health. So we've been calling for, through our campaign, #BlanketChange, and inviting communities and organizations to come together to demand holistic policy change. Blanket change is comprehensive change for maternal and infant care, but frankly, it's in many ways to address so many other topics that we're talking about today, whether it's around diabetes or other kinds of issues. Because if we fix the underlying issues around our social determinants, we can actually solve a big chunk of improving health outcomes. We're fortunate right now that Vice President Kamala Harris, before she became vice president, was one of the biggest champions in the Senate for maternal and infant health legislation. We're so excited that the Momnibus Act, addressing maternal and infant health, especially maternal health improvement over time, a whole host of bills that have been reintroduced into the House, is well on its way with the leadership of folks like Representative Alma Adams, Representative Lauren Underwood, Representative Kelly. You are a big part of that, as well as so many others. A whole host of different things that look at expanding Medicaid is so important. Extending Medicaid postpartum, because it doesn't help if you've got chronic health conditions and you get dropped from Medicaid 2 months after your baby is born, but you're still dealing with issues around diabetes or hypertension or other kinds of chronic health challenges, and you cannot get to affordably to seek care. Even paid family leave is a huge issue for us, because these are the kinds of policies that have already been in place in many highly industrialized countries, and we know they work. So taking a more evidence-based approach, collecting good data, leveraging technology. If there's one thing the pandemic has shown us, is that we just can't go back to business as usual. We need to figure out how to reach people. For the half of all the counties in this country that lack or have very limited access to maternity care, affecting millions of women of childbearing age, we should no longer accept that women not only do they not have health coverage, they may not even be able to see a high quality healthcare provider within an hour of where they live, and nor may they be able to access it through any virtual means either. So again, we should take this lesson of this pandemic, but we should also not forget that for many, many decades, we've been living with a situation which this country has failed to confront the very essence of why we have these health inequities in the first place. And that is because we have systemically failed to invest in the people in this country with respect to their health outcomes. And we've absolutely failed to do that for communities of color. And that's exactly what our organization, the March Now, is largely about, is making sure we advocate for those changes alongside these other tremendous organizations that we're talking with today.
Thank you so much. And I'm happy to say, we had all of our markups, and the expanding Medicaid to a year made it through in the Reconciliation and Energy and Commerce. And we'll be voting on it when we return this week. So I am very thrilled about that. We still want to push the different parts of our Mamas Act too. We're still not giving up on that, and best practices and those kind of things. At this time, I'm going to turn it over to my senior advisor and my everything health person, Nicole, and she has some questions for you guys. So Nicole?
Thank you, Congresswoman, and thank you again, ladies, for just being here to joining us here today. It's so inspiring for a young person like myself, who didn't expect to be speaking today, to be surrounded by women such as yourself, the Congresswoman, Ms. Williams, Ms. Blunt, Ms. Brown, Ms. Stewart. If you ladies would like to weigh in a bit about what it's like to be a woman of color in positions, at the top of your fields. Congresswoman is a vice chair of the Energy and Commerce Committee, and you ladies are CEOs. If you could just talk to young Black women like myself and tell us, like, how did you get here, and what advice can you give to the younger generations who are coming your way? Ms. Blunt, I'll pick you first.
You'll pick me first? Okay. Well, I'm just thrilled that there are young women like you, Nicole, who are interested in the subject matter. You know, not everybody can bring policy to life. Congresswoman Kelly is one of the rare numbers of people who can actually make it really relevant, but it is, because it determines, as you've heard, access. It determines what our cities look like, what our experiences can look like, and you know, as Stacy said, you know, we're talking about policy that has to combat hundreds of years of legalized oppression. But I would say, you know, just from my own experience, having come through the sciences, epidemiology, you know, it was a bit of a struggle because, you know, back then, Black people were not assumed to be competent in science. We know that is ridiculous, but I faced personally a lot of questioning, a lot of doubt, a lot of second guessing, because I wanted to be in the science. I mean, I literally, in my public health program, had a professor say, well, you know, Black people really don't do biostatistics very well. So I mean, that's, you know, sort of in your face racism. And of course, you know, it didn't hold me back. But the issue for all of us, I mean, being in Georgia, where I am, and having the privilege of being able to support and Stacey Abrams and watch what Stacey Abrams did here, underscores the importance of understanding the issues, understanding what's happening in your community, being able to ask the right questions. I mean, we all of us on this call now expect agency and capability from Black women and Black people. And a dear sister of mine said, you can either look at people through the lens of the problem, or you can look at problems through the lens of people. And we all have decided to start with people. And by definition, we start with people. We don't start with the problems. And we have all elevated our work to that end. And, you know, for you and young women, young men coming along, it's, you know, understand the issues. You know, I kind of kept my head down. I worked hard, like a lot of us. But like a lot of us, I also had luck. Somebody had to open the door for me. And we then are opening the doors for those who are coming behind us. The fight continues, it's not over. But what I tell young Black women is, you know, having been in private industry as well as in public health, is help those around you. You know, I understand competition, but you can compete with compassion. Make sure that you are bringing folks along with you, because there's not nearly enough of us in the room where it's happening, and we need more of us. And, you know, just one thing I would say, despite all that, rest more, play the long game. I needed to be a little less headstrong, perhaps, as a young person, but understand that this is a long journey, and make sure that you stay in contact with those around you.
Yeah, Nicole, thank you for that question. Linda, I love that. Compete with compassion. That is awesome. And, you know, I think a lot of young people look at women, you know, in sort of our positions and think, oh, gee, that's what I want to do. Well, let me tell you, on a daily basis, you know, it's a lot that comes with with the job. I mean, you know, to whom much is given, much is respected, demanded, and required. And, you know, it is a full-time commitment through your professional life, your personal life, when you take on a position to lead not only you know, complex organizations, but just lead on incredibly important topics, and to be a voice, and sometimes a lone voice, for some of the things that your organization stands for and what you believe in. You know, I think it is a tremendous honor. I did not, unlike Linda and maybe others, I did not come to this position of leading the March of Dimes because of a background in public health. I really came to it because I went to business school and studied business, and worked on Wall Street for a while, and worked in corporate America for a while. And then, but all along, even when I was working on Wall Street, I worked in an area called public finance, which was the combination of my finance training and doing good for the public. And so in my career, I had made a decision early on in my early 20s that whatever I did in my life, I would have to not only do something that I felt was drew on the things I was interested in around economics and how communities work and how the economy works and how businesses work, but that whatever I did would have to do good for others. That I knew I wasn't going to be able to live with myself. If it was just about making money for others or myself, that I would have to spend my talents doing something good for others. And that eventually led me to even this role in a nonprofit organization, leading a nonprofit organization. In fact, this is the third nonprofit organization that I've been the president and CEO of in my career. And I can tell you this is absolutely the most rewarding experience because I am a mother, I am a Black woman, and to be able to take my role and have it apply to women and babies overall, and especially focus on women and babies that look like me and my little girls when they were little, but they're big now. It's just really an incredible honor and a duty, and that's what drives me every day. I think just aligning that personal passion with your professional pursuits, it's always been something that I've cared deeply about, and I've been more focused on whether or not I'm doing that work successfully than how I'm advancing my career. I always felt like at the end of the day, God would put me in a place to do the most good for the most people. And I think that's what has happened. And I wish every day, and I hope every day I'll continue and be able to do that and provide that service to others. So that's how I look at where I've been and where I am right now.
Awesome. And, I'll jump in, Nicole, and just quickly agree with what has already been said and just say that I am encouraged and I'm inspired by young people. My hope is that the young people will continue to grab the mantle and drive much needed continual transformation and change. And when you think certainly about the number of African Americans that have left a positive imprint on this world through the social and transformative change they have made over the history of this country, I am encouraged by young people. So I want to encourage you to take that mantle. And what I will say is for me, it goes back to purpose, passion, and position. Like Linda, I'm a chemical engineer, so the sciences and having curiosity. So I encourage people to continue to have curiosity because this is how we're going to solve a lot of these tough problems. But everyone is born, I believe, with a divine purpose, and I think that you need to examine yourself and truly understand what is uniquely Nicole here for, because you have a unique purpose, a God-given purpose. Circling on that, then the passion. Where do you have passion? What actually motivates you and brings you life? And then your purpose, your passion, and your position, align it with your position. Look, you can do anything you want to do. My mom's always said, you can do anything. And we can. So find the position that aligns with your purpose and passion. So I spent 30 years in the for-profit space, working for some of the largest organizations in the world, Walmart, Exxon, Procter & Gamble, and the like. And it wasn't until my 5-year-old daughter, she's now 17, asked her mommy if her mommy was going to die from diabetes. That was the life change for me. And that was a change that said, where should I be having impact? Where am I going to live my imprint in the world? And decided that I was not okay with the plight of what was happening with diabetes, and more importantly, the plight of what was happening with diabetes for people of color in this country. And I made the jump from for-profit into the nonprofit space. So I say all of that to say, Nicole, purpose, passion, and position, line it up and just keep carrying that mantle for us.
And I just want to say one thing, and that is find your voice and use it. And it doesn't matter what age you're at. If you find your voice, your authentic voice, and know who you are, then you are empowered to do all the things that my fellow panelists just talked about. And it doesn't matter what age. And we can start by equipping our young girls to have that self-confidence, to know who they are and to be bold, and also just to be courageous in terms of facing issues that we are confronting. And it doesn't matter at what age. I remember from elementary school to junior high to high school, I was always fighting the fight. I was always fighting for equity and in undergrad and then in law school. So I just want to say that all of us are seated here on the shoulders of other women and men that have gone before us, but we sit here today waiting to just propel those of you that are coming behind us to the next level, to run faster than we run, to disrupt even more than we've been disruptive, and to really help to solve for a number of these issues that we're talking about today, because they are solvable. If there's a will, we can do it. We're taking again this moment in time to fulfill each of our kingdom purposes, and that is to use our unique gifts and talents and our treasure to do more for the people that look like us, number one, but also those that don't look like us. And that's the piece that we're trying to convey over and over again. We don't have to be divided by tribe. That's unnecessary. This is the richest country in the world. The United States of America has the ability to create an equitable, inclusive platform where all are welcomed and all voices can be heard.
Thank you so much, ladies. That means so much to a young person like myself, and I know many other women who are out there listening. And I just want to, in the few minutes that we have left with the Congresswoman, transition a little bit to our discussions about COVID-19 and the effect that it's taking on the different communities that you all serve. How can Congress better engage with your patient populations for disseminating information about town halls, vaccine information, and overall health-focused information? You know, we have a lot of folks out there who are hesitant to take the vaccine because of how quickly it was developed, and they don't feel that they can trust it. What is the best way for us to communicate with your constituencies to get the information out about different health issues?
Well, I would say this is a great example of how to do this. Regular briefings, talk about the data truthfully, collect the data. I mean, we still are not collecting all of the data that we need, so we don't have a complete picture. So that is one of the things that I know Congresswoman Kelly and her colleagues are concerned with, is making sure we have the data. But we also can take a page out of the Congresswoman's book and really understand not only what the pandemic and the economic fallout means, but what racial equity would mean for our communities if it were achieved. I mean, she can paint the picture for what life could look like, what the lived experiences can look like. And that's the goal we should all be working toward. And if the Congresswoman and her colleagues can continue to talk about, here's what life would look like. You know, Angela, I love that. This is not just for us. And also, this is not our problem to fix all by ourselves, but this takes everybody. So if we all had that shared vision and communicated it with facts, with evidence, with truthfulness, with compassion, then we all could at least be headed in the same direction. And however we get there, whatever vehicle we choose, that's fine, but we know where we're going. And if we had that shared vision of equity, imagine what that would do for us.
If I could just say that, you know, we're facing a particular challenge with respect to the vaccine and pregnant women, because pregnant women were not initially involved in the clinical trials. And when we look at clinical trials for any kind of vaccine or drug, you know, it's important that we can point to certain populations and those included in the trials to know for sure, or with some high degree of certainty, that the vaccine is effective and works and is safe for those that might ultimately receive the vaccine. In the case of pregnant women, because pregnant women were not involved in the trials, we definitively have not been able to say to pregnant women, We've seen it. It's been proved in the clinical trials that it is safe and effective. So we have, for a while now, have been in a very difficult position. Us and ACOG and many others have been encouraging pregnant women to receive the vaccine when it's their time. We know based on how these two vaccines, the Pfizer and the Moderna vaccine, were developed, that there is a very low likelihood of any kind of challenges that pregnant women would receive if they are able to access the vaccine. But again, we're using an old methodology of clinical trials, not including pregnant women. And of course, there may have been very good reasons and have been very good reasons for pregnant women not being included. But I can just say that we're very excited that Pfizer announced last week that they would start including pregnant women in trials. That will give us more ability, Congresswoman, to be able to go to women and pregnant women and ease their minds and calm their nerves about whether or not it's safe to get the vaccine, whether or not it will harm them or their unborn baby. And we just believe pregnant women should not have to be dealing with that in the midst of a global pandemic, where we know pregnant women, are at a much higher rate of, if they contract COVID, of having severe illness. So here pregnant women are faced with either I could get COVID and really have an even likelier chance of something, some really, really bad outcomes happening, or get a vaccine that I really don't know and not sure if I can trust. And that just really is a unbearable sort of position for pregnant women to be in. So we're glad to see more evidence come through, hopefully soon, that will be able to show pregnant women, that they can be protected. And in fact, will be doing a good thing for themselves and their babies if they do get the vaccine. The last thing I'll just say is that, we're going to have to do more to overcome the historic distrust that many people of color rightfully have about the medical field, about medicine itself. We understand where these issues come from. But, I had a discussion with Andy Young and former Ambassador Andy Young last week, who said, I've been vaccinated for a whole lot of things in my life, and I'm here at 89 years old doing fine. And at some point, we just have to accept that, yes, the past has often not treated us well, but that should mean that we should disregard the science of today and listen to the people who look like us, who looked at these issues, and be willing to go on their word to understand that what we're doing is protecting ourselves and our communities, and that the science is there, the evidence is there, and we can trust it for where it is today. And we should encourage everyone in our communities to get the vaccine when it's their time, because our life depends on it. And we should not be at a disadvantage with respect to access to the vaccine any more than any other person in this country. In fact, we should be able to be advantaged in this whole process because of the kind of disproportionate impact that COVID-19 is having on us. So, we're hoping that just more and more of us can be out there championing this and making sure that more and more folks like us can get access to the vaccine when and if it's available for them.
Yeah, and I just quickly add, Stacey, to your point, our communities are being ravaged by this. And rightfully so, there is the distrust that exists. I mean, for far too long, our health has been ignored and even abused in the name of science. So we get that. But also this point about weighing the risk of taking the vaccine versus being infected by COVID-19. Again, when you look at the data, people with diabetes are 6 times likely to be hospitalized, 12 times likely to die. 40% of the deaths from COVID-19 came from people with diabetes. Again, you overlay on that the disproportionate number of people living with diabetes are people of color. The numbers are horrible. And so to your point, I think we all have an obligation to get the right fact, science-based information out there in people's hands. Yes, the vaccine was developed quicker than ever before, but technology has also improved. Testing did include people of color on these trials. We had scientists all across the country and the world of multiple races participating in developing of this vaccine. There were people of color on the review panel for the FDA. I mean, so we've got to take all of the data that is out there and use that to make the right decisions. I too support the vaccine. I read a report where 35% of African Americans, just 35%, saying that they would take the vaccine when a large majority of us in our communities are dying. That's actually not okay. So we got to continue to get the data out there. You can go to, we have a COVID-19 page on diabetes.org that has information, but I agree, we have to take a page out of Congresswoman Kelly's book and all, you know, get out there, town halls, get into these communities. People need to see people like us talking about this willing, but the right data's got to be out there. There's so much misinformation out there, and that's the scary part. So I am in line to get that vaccine as a person living with diabetes. You know, we're still fighting to get people living with type 1 diabetes also has to be prioritized, but I'm going to be there based off the data and the science that I have seen.
Just something I want to say, I just looked at the chat just briefly, but and my understanding is that a number of states are pushing into Black communities and working with Black churches and Black organizations to get the vaccines to people that need them. And also, I have not seen that there's necessarily a requirement that you have insurance coverage. So I just want to clarify that there is the opportunity and there is a push for everyone to get vaccines. But if I have misspoken, I would say look at any of the websites any of our websites, just to make sure that you get the correct information. The second thing I just want to say is that we want to continue to push for diverse clinical trials and for diverse researchers to research diverse populations. And so that as the story is being researched, it's not told by one particular lens, experience, or viewpoint. So I'm hoping that as the Congressional Black Caucus is looking at doing some research on the impact of COVID-19 on the Black community, that there are researchers of color that are participating in that. And I would just say, even when you're looking at subsections, whether it's people with disabilities or it's people with diabetes or whether it's women or mothers, that I think I would say for all of our panelists, we stand ready to partner with you in this effort, because again, this is a moment in time where we can affect change, and it's important that we address a lot of these issues that are right before us. They've always been there, but now they're uncovered and we need to move forward. And so I really do hope that this is part of a continued movement towards equity.
And Angela, that's a really great point, is that you should not be charged for the vaccine. So I would just encourage people, if they're being charged, to make that public. If you're on social media, let folks know, because you should not be charged. And one, just in the spirit of sort of the facts, on our YouTube channel, there is a video about the vaccine and what it is and what it isn't. So it really helps explain what happens when you get the vaccine and what you can expect. So we're doing our part, like, you know, all of you, to try to educate so that from our perspective, Black women can make the best decisions for themselves and their families.
Thank you so much, ladies, and thank you so much for pointing out that the vaccine will not be, there will not be a charge. People who do not have insurance will be able to receive the vaccine with no need for an insurance or any payments. In the last few minutes that we have, if you ladies have very quickly any parting advice to the audience as a call to action, please share that with us before we depart. Let the Congresswomen and the rest of you go on about your day.
I'll just real briefly read our policy agenda, read our pandemic guide on our website. It has lots of resources. But importantly, know the economic and health data in your community so you know what equity looks like and when it's not happening. And pay attention to what your elected officials are doing at the state and national level. Unfortunately, they're not all like Congresswoman Robin Kelly, but she gives you a great basis for comparison. And if they're not, what the work they're doing is not promoting equity, let them know. And then just for everyone on this call and everyone listening, remember to breathe.
And I would just say again, easterseals.com. We have ways to get engaged. You can receive our grassroots alert, action alerts to notify your local congressperson if there's something that affects people with disabilities, and we want you to be engaged and use your voice and your power to be able to affect change. Obviously, voting is important, and voting with those that are willing to do the right thing for all of our constituencies and not just for a few.
And finally, I would say just quickly as well that there are multiple levels to these groundwater solutions, and to the point that was made, use your voice to help drive the necessary change. And I'd also say, particularly during this time, take care of yourself right now. That's one of the most important things that we can do. Your mental health, your physical health, everything that you can possibly do. And then the final thing is, I'll say that, the great Shirley Chisholm, one of the quotes that stuck with me and always sticks with me is that you don't make progress by being on the sidelines. So we need everybody to get into the game and in the fight. Thank you.
Also, I would just like to say, first of all, again, thank you, Congressman Kelly, for this, and always a pleasure to be with Angela and Linda and Tracy. I put 2 links in the chat, or in the just on a couple things. One is information that you can disseminate and pass on around pregnancy, being pregnant, having a newborn in the midst of coronavirus. And also just how to become more engaged. I mean, we are constantly recruiting more and more people to be advocates. We have dozens of organizations that are part of what we call Blanket Change. Blanket Change is all about advocating for policy change at the federal level and also at the state level for a lot of the policies and that will address some of the systemic challenges that we've been facing, addressing some of these health outcomes, especially around the maternal and infant health crisis. But frankly, some of these changes would go beyond just that alone and would help health outcomes overall. For example, Medicaid expansion, extension of Medicaid, things like that. So we would love to, invite everyone, as I know all organizations on here would love to invite more and more people to be a part of this fight. Your voice matters a lot. We know, we've seen the power of women, the power of women's voice, the power of Black women in this fight for our own health and for our own communities. If we can't do it for ourselves, no one's going to do it for us. It is our responsibility to demand outcomes that will improve our lives. And frankly, I believe that if you solve things for Black people, you're going to end up solving things for a whole lot of other people too. So we just have to come together as one and be in this fight together. And I think that's one of the joys of being on this call and being in partnership with some of the other organizations, is that we are in a fight. Even though we may have specific areas of health that we're focusing on, it really stems from large systemic challenges in this country that if we work together, we can solve them, I think. And I'm very confident about that.
Thank you so much, ladies, for taking us here today. I think, as I've seen in the chat, this was informational for me, and as well as the other folks who attended today. We thank you for your hard work in all of the communities that you serve, and we thank you for being here with us today. With that, we'd like to close. Congresswoman Kelly, would you like to give any parting words? Oh, I think she might be frozen. Well, with that, I again want to thank all of you for being here with us today, and please let us know how we can continue to be helpful, especially as we, there's a request to put your info in the chat if you can. And as I close, the Congresswoman says, thank you. Technical difficulties abound in this new world.